Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we continue from lecture 3, part 1 by revisiting MCQ number 4. During the presentation, I will go through the MCQ slide, and immediately after discussing the MCQ, I will explain the related content from which the MCQ was created. This approach will help clarify your concepts and assist you in preparing for ASCII and Viva exams. A 35-year-old patient is undergoing the removal of a mandibular first molar with a missing crown, and the oral surgeon decides to section the roots to facilitate removal. Which instrument is commonly used to section the roots in this procedure? So the options used for smoothing bone, not sectioning, used to grasp and remove roots, or crown knot for sectioning. Number 8, round burr or fisher burr is used. This is the correct option. Here you can appreciate the surgical handpiece with a fisher burr used to section the tooth into mesial and a distal half, allowing each root to independently be removed. Tooth sectioning is usually accomplished with a straight handpiece with a straight burr. This is the straight handpiece with a straight burr, such as number 8, round burr, or with a fisher burr, such as 557 or number 703 burr, under copious irrigation. Used for delicate removal of root tips, not sectioning. Used for luxating and mobilizing roots, not for sectioning. So the correct answer is C. Now, let's discuss the content from which the multiple choice question was created. The surgical technique for extracting multi-rooted teeth, emphasizing the unique aspect of converting a multi-rooted tooth into a single-rooted sections. Initial surgical step involves creating and reflecting a long envelope flap to expose the tooth and surrounding structures. This lower molar has roots that make it necessary to section the tooth. The flap is raised to expose the bone, allowing sectioning. Note the small releasing incision on the mesial and distal sides of the tooth. Assess the necessity of sectioning roots and bone removal after the flap is reflected, and utilize appropriate tools for visualization and mechanical leverage. The surgical handpiece with the fisher burr used to section the tooth into mesial and distal parts, allowing each root to independently be removed. This steps involves the removal of crystal bone and the sectioning of the tooth using specified burrs under copious irrigation to ensure precision and minimize damage. Focus on using elevators to luxate and mobilize the sectioned roots for easier extraction. Different techniques based on the condition of the tooth crown, using forceps for intact crown is shown in this figure, and elevators for missing crowns. Outline additional procedures for stubborn roots, including further bone removal and using specialized tools like the crane pick elevator. Concluding steps involve ensuring the surgical area is smooth and clean, followed by proper flap repositioning and suturing to promote healing. The completed procedure with chromic suture closing distal release. Thank you. Wish you best of luck.